evening. You're watching NDTV with me, Rishika Barwa. This is the show where we take your questions on the coronavirus. A panel of expert doctors will be joining us on the broadcast to answer some of those questions. Today, we want to focus on what you should do once the lockdown is gradually lifted. Remember, India has entered lockdown 3.0. This means that there are several restrictions which have been eased in several parts. What should you do as you resume work? What should you do as you start to step out of the house? Remember, the fear and the threat of the coronavirus is very much still there, yet economic activity will be resuming. So we have two expert doctors joining us on the broadcast this evening. Dr.Sujeet Jha, he's the Principal Director, the Institute of Endocrinology and Diabetes Metabolism from the Max Healthcare in New Delhi. He's a very learned doctor joining us on the broadcast from Delhi. We also have Dr. Hemant Takker. He is consulting physician and cardio metabolic specialist. He's been associated with several hospitals, Jaslok, Breach Candy, Bhatia, Dalvi Hospital from Mumbai. So he's also an advisor to the government, I'm told, in dealing with the pandemic. Appreciate you, doctors, for sparing the time of day to be with us on the broadcast and take on those questions. Dr. Takker, if I can begin by asking you, whole host of questions on everyone's mind right now on whether it is safe, to go about our life, to go back to work, to sort of resume life as we know it in some way, because the threat of the coronavirus is very much still there. What would you like to tell our viewers?
See, this virus is not like a Cinderella that at midnight it will disappear and everything will change. Neither is it a magic wand that you will wave after lockdown 3. In fact, I would say that you have to be ultra careful, more careful. Today, when and if you step out to buy your essentials or medicines, you have lesser people on the road, hardly any traffic, and everybody is observing social distancing and discipline. We can see trailers of what is going to happen when the lockdown is lifted. When you see what happened today when the liquor shops and the migrant trains and everything were released. So I would say that in fact things will get worse in the form of exercising caution and discipline. You have to do everything that you are doing now and more. Because by lockdown, all that you have done is you have punctuated the spread of virus.
Right.
And you have hopefully down-regulated the virulence of the virus that is going to spread in the community. And you have allowed doctors and healthcare workers to upregulate their response, their action, and everything else. So one has to be extremely careful. History has shown us that if you go back and rejoice on the streets, the second wave which comes is going to be worse than the first wave.
It's very interesting, and you raise a whole host of important points. We'll talk a little more about that second wave in just a bit, because that's a question on everyone's mind. And, many even saying, is the first wave still over? Because just yesterday, India saw the largest ever rise in cases, the biggest spike recorded in Delhi, in Punjab, worrying news coming in from Maharashtra as well. So it's not like the numbers are reducing, but obviously the economy has to restart. People have to be allowed back to work in a phased manner. So this is a necessary evil, as many would say. But Dr. Jha, would you agree, that the challenge is actually not over? The bigger challenge now awaits us in terms of how we go about our life as the coronavirus still exists.
1.5% mortality. It means, large number will die eventually of something. It could be me. The question is, what will happen with the virus or the infectious disease? The question is, how many deaths are also happening due to tuberculosis? Almost like a 4 lakh deaths. 25% of the population tends to die of infectious disease. The last 10% dying of the road traffic accidents. We are a country which has got a wide spectrum of preventable death, which includes the respiratory droplet infection secondary to tuberculosis. So the question is, how far we should concentrate on this 1,500 deaths or 5,000 deaths or 10,000 deaths? Yes, we are worried about it. But if you look from the West perspective, the infectious disease is quite low. But if you look from the Indian perspective, we have a huge infectious disease burden, which is preventable as well. Road traffic accidents, which must be the highest in the world. So the question is, shall we shut down everything just because of a sake of coronavirus or COVID virus. I'm not saying so far what we have done is good. We have bought time, we have things in place, the hospitals are ready, the epidemiologist, ICMR is ready, the kits are ready. I personally feel that we should slowly, gradually open it up. We are educated. Every Indian is educated now about what we should do, and we have tradition of what we call as a truth, unfortunately, which has come from our society. So we do understand,
Right.
and this is that deep embedded in the village. So I personally feel that we are also used of covering ourselves, which is traditionally quite high amongst any world population.
You know,
So we
I'm
do
going to-
understand how to cover our face.
Right.
We do
I'm going
understand
to
what is
try and
touch.
I'm going to try and address some of the nitty-gritties, because we've had questions pouring in. There are people who've written to us online, and the questions are very small. Dr. Takker, more often than not, the questions are very existential. So I want to ask you a very straight question. If people are returning back to work, and you've said that all of the social distancing, the mask, the hygiene that has been followed during the lockdown has to be followed more so once the lockdown is gradually lifted. But what do people who have to now go to work gradually and then come home to elderly parents or children, what would you like to say to them? What's the advice you'd like to give them?
So when you go to work, the mask is going to become a part of your system. Distancing yourself from people sitting in the office is also extremely important. How you travel will determine with how many people you're going to rub shoulders. Now, I'm not trying to be more Catholic than the Pope, but remember, countries which probably lifted the lockdown early, like Singapore, have rebounded back because the number of cases have increased. Fortunately, as my learned colleague Dr. Jha said, the virulence of the strain in India does not seem to be so bad, where people are being hospitalized and we've had to choose between ventilators.
Right.
But having said that, we don't know how many strains are lurking. It's been 6 months, madam, that we've had this virus. We still don't know anything about it. We are learning everything new. We haven't got a drug. So when you come home after exposing yourself to people on the train or in the public transport or in the office, the first thing you should do is go and sanitize yourself with a good hot water bath and soap. You must use soap and hot water bath, and all your belongings, either you learn to keep it in a small basket near the door where you enter, and then go and sanitize yourself before you meet your family members.
Right.
The responsibility that you have is in as much to yourself as it is to your elderly parents and
Absolutely.
neighbors. I think it is better to be a little more cautious than to be a little more carefree. I agree the economy is important. I agree that we've built a grey halo around the virus. But if the numbers which translated in Europe, Italy, America and elsewhere were, God forbid, to come to our country, we don't have the wherewithal, and our health services, no matter how much we have prepared in this stage 3 lockdown, we could crumble.
Well, those are wise words there, and I hope viewers who are going to be, gradually getting back to their life are taking that advice and writing it down, because remember, it's as important to maintain that social distancing and hygiene for yourself as it is for your family members, especially the elderly and the children in your homes. Our first caller, Dr. Virendra Singh, is dialing in. He's a doctor himself. He's calling us, I'm told, from Himachal. Go ahead, doctor.
Yes, my question is whether eyes are also entry point for virus. Second question is, people are having different type of mask, so whether doctor has some recommendations for a special type of mask for protection from coronavirus. These are my two questions.
All right, very interesting. Dr. Jha, would you like to take that on? The eyes as a point of entry for the virus, and mask etiquette, which is very important now.
Yes, eyes are supposed to be, maybe that's why we have an eye protection when we have any protection in the hospital setting. The question is about the mask. The government of India has clearly laid down the guidelines, and for medical professionals, depends upon which part of the duty you are into the ICU or different settings. The government has clearly, ICM has clearly defined what sort of mask, N95, medical, surgical mask, and a simple basic mask, what we can use in day-to-day use, which has been again defined by Government of India. So I'll advise that. So most people should be able to use the mask what Government of India has advised.
Right.
But as far as the specialized for doctors in the OPD, yes, you can have N95 mask with the gloves on, and it's better to have eye cover as well if it's possible.
Dr. Takker, is there anything that you'd like to add? A lot of questions on mask etiquette, especially people who are using cloth masks. Not everyone in India can afford expensive masks or afford to regularly buy disposable masks. What would you like to tell them?
I would say if you can't get your hands on anything, use a cloth mask, but cover your nose and your mouth. A lot of people wear masks for the sake of wearing it. You see people on television with masks around their neck. Others you see over only the lips. So cover yourself. And for doctors, my Himachal Pradesh colleague, you don't know what your patient has, harbors, or tells you anything about. So you need a proper mask with no leakage going into either from the nasal areas or the mouth areas, because remember, it's the mucous membranes. So it's the mucous membranes of the eyes, the soft conjunctiva. So you need glasses like the ones which we give to our patients after cataract,
Right.
tight Batman glasses to prevent entry. This is going to slow down your speed of work, but then
Right.
you have no choice.
But doctor,
have
would
to
you
use
recommend
this.
the glasses for common people as well?
I would not say, because the people who are going to work, if they are going to distance themselves, it is all right.
Right.
But if they can lay their hands on these transparent glasses, it doesn't hurt. It,
All right.
if at all, will help.
All right. Vishwanath Rao is dialing in from Varanasi. Vishwanath ji, आप क्या पूछना चाहते हैं? All right, I'm afraid we've lost that line with our caller from Varanasi. We'll try and reconnect with him in just a bit. But let me come back. Like I've been saying, we're talking about some of the most basic, fundamental questions on social distancing, on the do's and don'ts as the lockdown is lifted. And like both our doctors on the panel this evening has said that it's just the beginning of an even bigger challenge. You have to maintain more precautions than what you were adhering to perhaps during the lockdown as well. Okay, I do believe we have our next caller, Sheshraj, joining us from Bangalore. Go ahead.
Hi, good evening to both the doctors. And firstly, I think as a doctor fraternity, I think you guys are doing a great job. My question is probably slightly digressing from the corona. There are general people who goes to the hospital today of a general infection, probably a chronic lung patient. They're just unable to get into the system at all because they said you have to get into the corona test, and then getting a corona test is a big process because it's predominantly done by the government hospital.
Yes.
I mean, from the doctor's point of view, probably an educated person, affordable person can do, but I see quite a lot, and it happened to very close a cousin mine.
Right.
Something
Let
like
me-
that happened.
Right.
How do you really address this kind of situation?
Okay,
And what?
that's a very important question. I think, Dr. Jha, it's not like other diseases have stopped happening or people who are suffering from chronic diseases don't need treatment. What would you like to say to viewers who have other problems and need to perhaps go to hospitals but are really scared or unable to do so at this time?
So the question is, if the patient or whosoever suffers from comorbid conditions like chronic lung disease or heart disease wants to get into the hospital, if the patient has fever and the new cough or symptoms what we all know about the COVID-19 needs to be investigated. But government is very clear that we don't need to investigate everyone walking to the hospital for any admissions, and they don't need to be tested for COVID-19.
Right.
So I agree there has been challenges for a large number of patients in Delhi or across the country about these patients getting to the hospital. But I think the clinician used to judiciously use their clinical powers to understand this person can be possible COVID-19,
Right.
especially if they have symptoms, what we all know about fever or cough. They need to be investigated, but every patient doesn't need to be investigated like general community because they can have heart failure or any other conditions that causing the breathing difficulty.
Right.
But at the same time, you have to look from the hospital point of view that if you happen to have infection, it can spread to multiple health professionals.
Absolutely,
which
and it
also
has happened.
So
Yes,
the clinician
it has
should take a
happened.
judgment, and obviously, as I was discussing, the mortality can happen to not just 19. There are only 1,500 deaths. This country will have a large number of deaths can happen
Right.
because of so many other conditions.
Let me
The hospital needs to
also-
be equipped enough, and
Right.
be using sensible use of COVID-19 tests.
All right. Let me also ask Dr. Thakkar another question, because there are asymptomatic carriers as well. And as healthcare professionals, how do you guard yourself against, the infection at this point? And should it perhaps be made imperative for every patient undergoing any treatment whatsoever to first be tested for the coronavirus now? Is that perhaps what should happen in the next phase now?
So asymptomatic transmission is soon going to be the order of the day, because out of 100 patients, 85 are asymptomatic. So you and I won't even know that we have got it and it's behind us.
Right.
But as doctors sitting in the OPD, when we are seeing patients coming in with chronic lung conditions who have difficulty in breathing, if we are not wearing our N95 masks, our caps, our hoods and gloves and gown, then we are not protected.
Right.
So the first thing is to protect yourself. It's like an aircraft. When the mask falls, you first wear it yourself and they'll help the neighbor next to you. If you are well protected, then you examine that patient. And if you have a high degree of suspicion, then you need to ask for the test. The government has altered its rules and is telling you that not everybody needs it if they are not symptomatic. Not everybody needs it just because they are contacts.
Right.
The reason why probably you need to do it before undergoing surgery or admission is because if you went into an operation theater and you were found to be positive afterwards,
Right.
the whole theater, the anesthetist, the apparatus, everything then needs to be closed for 24 hours and for sanitization, which will jeopardize the working of the remaining hospital. So there is a method in the madness. Remember, the rider to this is we don't know anything. We are changing every day. We were first saying test, test, test. Now we are saying selectively test. And I cannot blame the authorities, because the authorities like us are getting feedback from us on the field and they are reshaping their laws for the good of society.
Well, a whole host of questions answered, but a whole host of questions still remaining. We're going to slip into a very short break. At this moment, our doctors will continue to be with us, so keep those questions coming. We'll be back in just a bit. Welcome back. Dr. Hemant Takker and Dr. Sujeet Jha continue to be with us on the broadcast. I would like to invite our next caller, Amit Sen, dialing in from Kolkata. Go ahead, ask your question.
This is Dr. Amit Sen from Kolkata. Post-corona, doctors, we understand that medical practice is going to have a sea change. How good is practice of telemedicine? Because medicines, as per government rules for telemedicine, is minimum and not all in vogue or use.
All right.
And
Dr.
there's
Thakkar,
another
would you like to
question.
take that on? Telemedicine and what the future of medical care is going to look like in a post-coronavirus world?
That's me. Yeah. So, the telemedicine is going to stay in now. It's going to be our new life, the way we're going to practice things. And it will not change the way we're going to practice, because ultimately we need patients right in front the way we're walking. And I've been using telemedicine. I feel that this is okay for the time being in the pandemic situations, but it can't be an alternative to the clinical visit.
Right.
Because there are so many things we can obviously miss. And it's very important to understand to get used to it. The software we are used to is getting screened, you get used to it. The patient needs to get used to it. We need to have electronic data. 99% of the patient data in our country is not electronic.
Right.
It's all handwritten.
All
Be
right.
in the corporate, or maybe we all have it. But it's very important to have an electronic database backed up. Then we can top up with the telemedicine.
All
it's going
right.
to stay, thanks to the government that has allowed this to happen, especially more for a chronic disease in a pandemic situation. But I think it's going to help us, but cannot replace the clinical medicine, which remains important in a country
Right.
like India, where you can't do millions of tests just because
Okay.
you're far
Our
away
next,
from-
I'm afraid I'm going to interrupt you there, Doctor. We're running out of time. Our next caller, Rubin Malkani, is dialing in from Mumbai. Go ahead.
Yes, I have a question. As a diabetic patient, what is the best way to build immunity?
All right. Dr. Sujeet, would you like to take that on? Diabetic patient, best way to build immunity.
I must say that there are a lot of things about immunity, about right from lemon to so many Ayurvedic stuff. That's true in the sense that we need to walk healthy, eat healthy, and control your diabetes. there's no specific way scientifically proven so far to improve the immunity.
Right.
What you have been doing for last many years would build up your immunity. Immunity in diabetes is healthy eating, more fruits and fibers, and walk, exercise regularly, control your diabetes,
right.
and that's very important.
Okay, so walk and exercise regularly is very important, and what both doctors have said is prevention is better than cure. And if you've been taking precautions, you need to perhaps take more precautions as the lockdown is gradually lifted and you do go about your business as usual. Appreciate you, Dr. Jha and Dr. Takker, for sparing the time of day and answering our questions so patiently. Thank you very much for joining us on the broadcast. That's all we have time for this evening. Thanks for watching.